Welcome to South Heart Clinic. This is our Westlock office, and I am Dr. Guillermo Salinas. I'm an interventional cardiologist, and we are very excited to have you here. I would like to thank the RGV Diabetes Association for the opportunity to educate our community about cardiovascular disease and diabetes. The Rio Grande Valley has a very high prevalence of diabetes, and it's very important to remember that cardiovascular disease is the top killer for diabetics. I would like to talk to you about two topics today. One is coronary artery disease, which is the development of blockages in your heart arteries that may lead to a heart attack, and peripheral vascular disease, or PAD, which refers to the blockage development in your lower extremity circulation that may lead to an amputation. These are complications that can be prevented, and that's why it's so important to talk about them. I usually tell my patients it's extremely important to focus on prevention. When you are a diabetic, you need to make sure that your cardiovascular risk factors are very well controlled, and we're talking about excellent blood pressure control, excellent blood sugar control, excellent cholesterol control. It is extremely important to exercise and have a heart-healthy diet. For lower extremity peripheral vascular disease, it is extremely important as well to take very good care of your feet. I usually tell my patients that it is extremely important that they have screening for the cardiovascular conditions. There are certain non-invasive tests that can be done to find out if you have heart disease or you have peripheral vascular disease. The CAT scan is a very good tool to do a test called calcium score, which is a test that can give us a very good idea of your overall cardiovascular risk. It is very important to remember that if you're diabetic, your heart symptoms may not be the classic symptoms of chest pain because of the damage that elevated blood sugar may have caused to your nerves. At the same time, this nerve damage can also impair your ability to feel your lower extremities, to feel pain, or to notice the presence of a lower extremity ulceration. When we're talking about screening, I usually tell my patients that they should talk to the primary care physician about these non-invasive tests, which may include a calcium score, or for PAD, ABI, ankle brachial index. This is a very easy non-invasive test that will allow us to find out if you have some degree of peripheral vascular disease. Even if you don't have any symptoms, prevention and screening is extremely important for your overall health. We invite you to learn more about these conditions, and here at South Heart Clinic, we are happy to provide services for our cardiology patients here in the Valley. Thank you very much.